In this video, you'll learn to administer first aid to a person over the age of 1 who is choking. There are 3 possible scenarios. Scenario 1. The casualty is breathing, but with difficulty. Encourage the person to cough and don't do anything else. Coughing is the most effective way of dislodging an object. Doing anything else could worsen the situation. Scenario 2. The casualty is not breathing, but is still conscious. Support their upper body with one hand and lean them forward. Give them up to 5 sharp back blows between their shoulder blades with the heel of your hand. If the back blows don't work, alternate with a series of 5 abdominal thrusts. Place your hand clenched in a fist in the middle of the abdomen just below the sternum and the hollow of their stomach. Place your other hand over it. Bend the casualty forward. Pull sharply inwards and upwards. Alternate 5 back blows with 5 abdominal thrusts until the casualty is breathing normally. Scenario 3. None of these procedures has worked and the casualty loses consciousness. Call or get someone to call the emergency services and start cardiopulmonary resuscitation. Alternating 30 chest compressions with 2 rescue breaths. If you don't know how to give mouth-to-mouth breathing, do chest compressions only, at a rate of 2 per second. Continue CPR until medical help arrives or the casualty starts breathing normally. If the choking person is obese or pregnant and you're unable to grasp your hands around them to perform abdominal thrusts, you can alternate back blows with chest thrusts. In this video, you'll learn to administer first aid to a person who has just broken their arm. Tell the person not to move their arm and to support it without bending or extending it. Use the victim's upper garment, such as a t-shirt or a sweater, to hold the limb securely in one place. This will help to prevent the fracture from worsening. You can also secure the limb in one place with the aid of a scarf. Call the emergency services or a doctor, especially if it's an open fracture, and follow their indications. If the victim is wearing any jewelry in contact with the affected limb, carefully remove it. Do not give the victim anything to eat or drink. In this video, you will learn to administer first aid to a drowning casualty. Get the casualty out of the water without putting yourself in danger. Depending on the state of the casualty, there are 2 possible scenarios. Scenario 1. The casualty is conscious. Place the casualty in a comfortable position. Cover the casualty and give them some dry clothes. Alert the emergency services, since the victim will have to be examined in all cases. Scenario 2. The victim is unconscious and unresponsive. Lay the casualty on their back. Tilt the head upwards to clear the airways and analyze their breathing. Try to hear or feel their breath on your cheek. or look for any movements of their chest or stomach as a sign that they are breathing. Alert the emergency services. Act according to the casualty's state. This means if the casualty is breathing, place them on their side in the recovery position. Cover and monitor them until the emergency services arrive. If they're not breathing, ask for someone to go and find a defibrillator. While waiting, begin cardiopulmonary resuscitation, altering 30 chest compressions with 2 rescue breaths. If you do not know how to give mouth-to-mouth, only perform chest compressions at a rate of 2 per second. In this video, you will learn how to treat a minor wound. Wash your hands before treating the wound. Rinse the wound with clean water and soap, if possible. If there is still dirt in the wound, use a sterile gauze pad to remove it. If possible, disinfect the wound with an antiseptic. Make an adhesive dressing to cover the wound using sterile gauze pads and adhesive tape, or apply a ready-to-use self-adhesive dressing. Make sure that your tetanus shots are up to date. If any doubt, seek advice from your doctor. Watch out for any signs of infection in the following days. If you notice any redness, heat, or pain, consult your doctor. A minor wound is a superficial cut or scrape with no profuse bleeding and which is not located near a body orifice or the eye.